evening and welcome to tonight's online event, done again in partnership with our dear friends at the Poor People's Campaign, entitled We Can't Go Back to Normal, a Moral Response to the Coronavirus. My name is Reggie Hubbard, and among the many hats I wear at MoveOn and in life, tonight I'm the moderator for this important conversation. Blessings, best wishes, peace, ease, and health to all. This is the third online event we've done together since the middle of March, all in an effort to create awareness about the necessity we have as a movement and as a people to shine a moral lens on our activism and outreach during this pandemic. Our first live stream discussed how to protect and care for one another at the outset of the virus, calling for bold, inclusive legislation that protected working people and often marginalized communities from the outset, and to pressure legislative solutions rooted in protecting people, not corporations. This program met the need of the moment, offering space for us to gather in community as we sorted out what was going on both with the pandemic and how to shift our lives in advocacy in the face of this risk. Our second live stream convened interfaith leaders during the Holy Week to derive inspiration from the stories of Passover, Easter, and Ramadan to inform not only how we advocate for current legislative relief, but to begin dreaming about significant changes we can make in our society at this present moment that bring us closer to our ideals of opportunity, liberty, and justice for all, narrowing the significant divide between what we profess as a nation with our mouth, but do not live out in our actions or policies. Again, tonight is called We Can't Go Back to Normal, and that's not meant to be alarmist. It's just merely a statement of fact. The truth is that for many of us, normal never worked in the first place. The nicest notions of nostalgia have positive connotations, but as many of us know intimately, nostalgia can be rooted in denial and erasure as well. In paraphrasing the words of my dear sister in the struggle, Ayanna Pressley, normal wasn't working for most folks, and there is no going back. The notion of normal emerged from generations of racist and anti-worker investment in these policies that magnify the inequalities between Black, Latinx, AAPI, undocumented, and Native American marginalized communities. And these inequalities have been exposed by COVID-19. Our society is largely rooted in these inequities, and we can't take that anymore. One thing we know beyond a shadow of a doubt is that these deep systemic disparities and calcified inequities are plain to see now. Why would we ever go back to that way of living? And how can we go back to normal when the administration has yet to honor the nearly 85,000 that have passed away, or show any concern about the tens of millions more who've been economically dislocated, either filing for unemployment or who were left out of the process in the first place, the low wealth, unbanked, and the working poor? Why would we want to go back to a normal that strips healthcare from millions of people in the height of a pandemic? Why would we want to go back to a normal that exacerbates division among us when at our core we want and need to be together to create transformational change to positively impact our communities? These are the questions we'll be exploring tonight. We're on the verge of more states loosening social restrictions starting tomorrow. And I live in the state of Maryland, which has had pretty strict coordinated response. And I'm still have many questions and don't feel as if we're going with enough care. So as states begin to reopen against the best recommendations of doctors, public health officials, and other experts, some elected officials at all levels are putting millions of people, especially the poor, at great risk by reopening too soon. In the name of protecting workers in the economy, their actions clearly demonstrate that some lives are expendable to them. This is clearly unacceptable. So why are we here tonight? MoveOn members, as well as our siblings in the Poor People's Campaign and across the broader movement, know in our core that we cannot safely roll back distancing measures without protecting people first. And their premature rollbacks will ensure chaos, more unnecessary suffering, which will ultimately harm the economy even more. Tonight, we will hear from respected leaders in the faith, healthcare, labor communities, and from activist circles to share their thoughts on why we cannot, nor should we, go back to normal, but use this moment as a pivot point toward reimagining who we are as a nation and how this is represented in our government and by its policies. Tonight we have Reverend Dr. William J. Barber and Reverend Dr. Liz Theo Harris, co-chairs of the Poor People Campaign, a national call for moral revival. We have Dr. Mary Bassett, director of the Francois Xavier Bagnon, I said that terribly, Center of Health and Human Rights at Harvard University, former New York City Health Commissioner and member of the campaign's Public Health Justice Advisory Committee. We have Sarah Nelson, the international president of the Association of Flight Attendants, CWA. And we have Kenya Alcocer from Union de Vecinos and the California Poor People's Campaign. As we often do, We'll be monitoring the chat for questions and comments and sharing them along the way. So feel free to comment or ask questions on MoveOn's Facebook live stream, and we'll collect them throughout the program. It is now my honor to welcome to the program my dear friends and fellow freedom fighters in this beautiful struggle, Reverend Doctors, Barbara and Theo Harris from the Poor People's Campaign. It's a blessing and an honor to be back in fellowship with you to shed light on these important issues affecting so many people. Blessings.
Thank you so much, Reggie, and thanks for everyone for coming on and to be with us, because indeed we cannot go back to normal. My name is Reverend Dr. Liz Theo Harris, and I'm happy to be here with you all this evening. As we know, before COVID-19, almost 700 people were dying every day in the United States because of the crisis of poverty. That's 250,000 people a year. Clearly, this nation has a high tolerance for death, especially when it's poor people, when it's people of color. And the national response to this pandemic so far has only further exposed the country's distorted morality. The federal government, the governors are putting millions of people, especially the poor, at a great risk by reopening against the best recommendations of doctors, public health officials, and other experts. As we'll hear, no state has yet demonstrated the capacity and public health infrastructure to reopen safely. Yet states around the country have begun to ease social distancing, lifting stay-in-place orders, and it's poor and working people who will suffer the worst consequences. These plans to reopen show no regard for human life or for human rights. They're prioritizing the profit of the few over the needs of the majority of people. We see how essential frontline workers in key sectors, including healthcare and food production, are actually expendable, working without protections, guaranteed paid sick leave, many working for poverty wages, and still going to work every day because they have to. We cannot be silent, as poor and dispossessed people are disproportionately hurt by these policies. We can't be silent with anybody being hurt by policy violence as a result of COVID-19. We know that hasty reopenings are not the solution to this crisis, but the real solutions lie in the implementations of the demands that this Poor People's Campaign, a national call for moral revival, has put forth, providing health care for all, a universal annual adequate income, paid sick leave, debt forgiveness, a moratorium on evictions and rent, and much more. And so this week, the Poor People's Campaign, a national call for moral revival, is launching the Stay in Place, Stay Alive, Organize, and Don't Believe the Lies campaign to raise a moral cry for non-cooperation with the dangerous and reckless policies to ease social distancing restrictions, reopen the economy, and force poor workers back to work instead of providing real relief. The relief bills that Congress has passed so far don't address the real needs of most people in this country. And so because these bills hold no provisions for permanent wages increases, permanent paid sick leave for all, or health insurance for the uninsured, poor and low-income people are being pushed back to work, which can kill them, their families, and many of their neighbors. We instead need a stimulus that centers the poor. And so on May 21st, we are organizing a national day of action to continue to push our demands for a meaningful relief package, calling people to stay in place, stay alive, organize, and not believe the lies. We refuse to cooperate with immoral actions of governors, state legislatures, the federal government to reopen the economy at our expense, killing poor people. Thank you so much. And I now introduce Reverend Barber.
Thank you, Reverend Dr. Liz, and thanks to our friends at MoveOn and all of the thousands of people that are joining us tonight, and also Sarah and Kenya, who we'll introduce in just a moment. I want us to sit with something for just a moment. All of them, from great and small, all of the politicians from great and small, and even some of their priests and their religious figures, have tried to heal the wound of the people lightly. They've only put a Band-Aid on the wound of the people. They lie. They lie. And they don't even blush when they lie. That is what that prophet Jeremiah said 2,600 years ago in the midst of a time of greed and lies and sickness and disease. It is what he said about leaders who decided to say there was peace, everything was fine, when actually things were not fine, particularly among the poor and the low wealth. He said, from great to small, from the great politicians to the small politicians, along with their self-proclaimed chaplains and their false prophets, they lie and they try to put a Band-Aid on the wounds of their people. The rest of that scripture actually says that the whole nation ends up getting hurt. There's no joy in what Jeremiah said. In fact, he cried quite a bit because the whole nation ended up getting hurt because of the lies. We are in a situation now, and for a moment, I just want those who are joining in to sit with this. Over 84,000 people have died since, let's say, February. Most of them between March and April and now May, 80,000. If you add 4 months, that's 20,000 people a month. And many of them are dying and did not have to die. When you look at other countries like South Korea and the number of people they have in that country and the number of people that die is so far. How is it that we are 5% of the world's population and a third of all the deaths? 5% of the world's population. And we are a third of all the infections. And yet, the people who are running the policies love to talk about exceptionalism. We're not being exceptional. Or they love to talk about their victims when Trump says he's a victim. People are chasing him. People are investigating him. But what about all these damn people who are victims of bad policies? These are not natural deaths. Yes, the germ is out there. But one scientist said the germ is actually puny. You can wipe it off with water and soap, warm water and soap. But if it's allowed to just have unrestricted course, it kills. And Dr. Mary Bassett, who will be on later, has let us know pandemics exploit the fissures and the wounds of our society. Liz, you're right. 1, 2, 3. 1, 2, 3 were the number of bills we passed. Democrats and Republicans, almost unanimous vote. I think we may have had 1 or 2 people that didn't vote for them. And then the president signed them. 1, 2, 3 bills, 27 million people were left out in the midst of a pandemic. Can you imagine that? You imagine the country being in the midst of a pandemic and they pass 3 bills and 83% of the money goes to corporations, not people, corporations, inanimate corporations. And then 27 million people who don't have insurance were just left out. When the one thing you need in the midst of a pandemic is health care and free testing. 3 bills, 62 million people were left out who work for less than a living wage. 62 million people. Now they got a title change from service workers to essential workers. It's a damnable shame to give people a title change, but you do not change the conditions under which they work. I had a labor leader say to me today, he said, tonight, say on the call, we have figured out what expendable, what essential means. It really means expendable, but they don't want to say that. So they say essential and give people buttons and hand claps at 6 o'clock in the evening. There's nothing wrong with that, but without what they need, without the protections, without the health care, without the testing, without the commitment. And it's 3 bills, Liz, 3 bills, 3 whole bills, 2.5, nearly 3 trillion bills, and 11 million undocumented workers just left out. The majority of the homeless just left out, just left out, as though the pandemic is going to go over there and sit among the undocumented people and not spread to the rest of the country. And with that kind of negligence, you want to open the country back up when the country is still closed to justice and closed to concern for the least of these. And then, and it bothers me, I'm a little animated tonight because I'm in the South, and it bothers me that particularly these Southern governors, open up, these Southern governors from Alabama, Mississippi, Tennessee, they open up, but they're the same ones that would not open up health care, the Affordable Care Act, they're the same ones that block living wages. They're the same ones where we have a third of the poor people in this country live in the South. What's wrong with folks? Have they gotten a hold of some racist lie and think it's only going to hurt black and brown folk? Well, they should know that's not the truth, because it even reached to the tops of the monarchy in England. This germ kills. And all it cares about is a host. But we know that poor people and brown people and black people are already predisposed by years of discrimination and the criminalization of poverty. And not 3 bills, and nothing in those bills to deal specifically with the disparity among the poor, the disparity among black people and people of color. Nothing in the first 3 bills. And so now we got a 4th bill, but we want to open up before we even finish the 4th bill. And McConnell has already said the 4th bill is dead on arrival. What kind of language is that when 80,000 people are dying for you to say a bill that might help people is dead on arrival? There is a place now, my brothers and sisters, where we must develop a loving and truthful, but a kind of militant, righteous indignation. It's time to stop being quiet. It's time to stop being quiet. A president uses the Defense Authorization Act to make meat pack workers go into meat factories and risk their lives and the lives of their community, but wouldn't use that same Defense Authorization Act to make sure that people had ventilators and masks and gloves. It is a damnable dereliction of duty. And what we know from these actions, what we can surmise from these actions, is that really for many people, when they say essential, they mean expendable. And for many people, there are too many people in power too comfortable with other people's death. Now they're going to question this. Somebody's going to say, no, we don't mean that. We really do mean essentials. But I learned a long time ago, and I didn't learn this from the Bible. I learned this from my grandmother, who said, if it walks like a duck and it quacks like a duck, then it must be a duck. So if you can call me essential all you want to, but if you don't provide the essential things I need to survive, then that's just words. So we are saying in the Poor People's Campaign, we can't get in the street. You know, if we could get in the street, we'd be in the street. We would be in the street. In times like these, we would be in the street. We would be doing civil disobedience. But we can't do that because we don't want to put other people at risk. But does that mean we can't be nonviolent resist? No. So what we are saying is join us for this stay in place. Notice we didn't say stay at home, because some folks don't have a home to stay in. But stay in place. Except when you have to do something. And those of you that may be of means, you need to stay in place to support those who are most vulnerable. Stay in place, stay alive, so we can fight for this country to be better. Don't give them the opportunity to kill you. Then don't believe the lies. But then organize. Let's use these phones and computers and internet and all of these tools that we have to light up the lines of the Congress. Next week, we're asking 100,000 people. We can do this. 100,000 of us to jam the calls to McConnell and Pelosi and demand that a bill be written from the perspective of the poor and low wealth in this country, because the public health scientists tell us if you're going to deal with this, you have to close the thing. Reggie, I'm going to say something, and I'm going to quit and introduce Sarah. And that is, we got to be careful about this language where they say the line is getting flat. Well, let me tell you what that actually means. A flat line in a pandemic, the way they're talking about, means that it's not so that there's not so many cases, that it's not overrunning the system, and it's not going to get the attention of the media. It does not mean there are no more cases. Actually, flat line in the emergency room means you're dead or dying. Flat line in this sense could mean that the clamor will die down, but people will still be dying. And the disease will still be sitting there to open up in the fall. And we don't know. You know, I know Trump talks about this magical going away in June and because of the sunlight. Nobody knows that. Nobody knows how this pandemic hibernates. We don't know any of that. And so more than a flat line, what we need is to move people above the line. See, folk that don't have health care below the line, don't feel that don't have living wages, live there below the line. We need to be moving people above the line. And so we need 100,000 of you all to join us in calling Pelosi and McConnell on next week and demanding a bill. Now, we haven't seen this latest bill. They say it's some good things, but we got to look. Does it cover those 27 million people? Does it cover those 62 million people working less than a living wage? No more cute words. No more title ships without policy transformation. Claude McKay says, if we must die, let us not die like hogs. This is the time to gird it up. We might not be in the street, but God knows if Harriet Tubman got 500 slaves out of slavery, she didn't have GPS, she didn't have Gmail, she didn't have Pandora, she didn't have Facebook, she didn't have Zoom, she didn't have what I don't even know. She didn't have none of that. She got 500 people out of slavery. All she had was moss on the north side of the tree and a north star in the sky. Surely we can use this time to stay in place, stay alive, organize, and don't believe the lies. And Sarah, who's with the flight attendants union, is going to share with us now why, from her perspective, we can't be putting these flight attendants at risk and all other people. And then Kenya, is she up here? She's going to come on and they're going to introduce themselves. But we want you to hear from the ground. We want you to hear some folks. And you might think it's interesting that we would have a flight attendant and then somebody who works among the homeless. But yes. Because many of you don't even know. You think flight attendants, because they're dressed up and they look all nice, that they're making all this money. Ain't so. And they are at great risk. So Sarah, talk to the people of America about why your union and flight attendants are joining us and why we must stand together in this moment.
We're joining you, Dr. Reverend Barber. I'm really pleased to be with you, of course, always. And our union has endorsed the Poor People's Campaign. Guess what? We have union members who are living in poverty. We have union members who are have the title of aviation's first responder and right now essential worker. But as new workers at some of these regional airlines, they are making $15,000 a year to do that work. And we say we can't go back to normal. Normal is sleeping in their cars. Normal is hoping for an assignment so they get a hotel room overnight. Normal is hoping there'll be some food left over on the plane so you can eat. And now these are essential workers who have had to come to work. Flight attendants have been coming to work since the beginning of this coronavirus outbreak. And on first blush here, we were the first ones to come in contact. And it's only because we organized and had a union and had OSHA training so that we knew how to handle communicable disease that we had even a chance against this virus to begin with. And we pushed the companies to give us PPE on the airplanes. Well, once that became community spread and everywhere, then of course there was no appropriate PPE even for our healthcare professionals on the front lines. And so what also happened at the same time is that demand completely dropped off. And if we had not organized to get some federal funding for our jobs, 90% of us would be out of work right now. 90%. But I want to focus on one thing first, because we're talking about jobs, we're talking about demand, and people may go straight to, well, that's why we have to open up our economy. Well, let me tell you something. The reason that we don't have people flying is because they don't want to die. That's right. And they don't want their family to die. And we have to keep rooted in humanity. The picture behind me is of Paul Frischkorn. He was the first flight attendant to die, and he was a friend of mine. And he was a union organizer and worked on explaining benefits to flight attendants. We've had 8 flight attendants die, and we have had other flight attendants who have struggled with this horrible disease and said to their flying partners, don't go to work, it is not worth your life. And so if we're not honest, we know how to attack this together. We can attack this together if we want to be honest about what we have to do. And we want to be honest about the fact that labor's mantra of an injury to one is an injury to all is exactly the mantra that we need to be taking in attacking this virus. Because if one person is hurt, we're all hurt. I think about what you were saying about, let's just pretend like the undocumented people are not our concern in the middle of a pandemic. Forget the fact that they're the ones likely who are doing the work that you're calling so essential right now.
Exactly.
And I think back about, 100 years ago, we were looking at the mine wars because there were immigrants who were working under the system of the coal barons who had people going into mines and didn't care about lives, but for God's sakes, make sure the mule comes out alive carrying that coal. Mm-hmm. And they had to organize even when they spoke 28 different languages in a coal mine, couldn't speak to each other. And in many cases, the coal barons hired them that way so that they couldn't organize, so they couldn't gain any power together and get their union and have a voice and have safety on the job. And that's what we're seeing now, is that lives are expendable. And there's this false choice between lives and our economy. And so now when we got some federal funding, but let me just tell you about that for a second. We did something that has never been done before in this country. And we said, when we get help to the airlines this time, this help is going to go to the workers. Because we've been through crisis. We went through 9/11 and we lost our friends. And while we were mourning, the capitalists were organizing. And they were organizing for how they were going to extract more from us than they ever had. We lost our pensions. We lost 30 to 40% cut in pay. We lost many, many jobs. We lost, many people lost their livelihood. Many people lost their homes. There were broken marriages. We've been through all of that. We've been through the suffering, and we know what happens when those who want to take a little bit more from the rest of us are fine with those suffering so that they can make more. That is the normal that we don't need to go back to, and that is what is being exposed in this pandemic. So we said, if you're going to build a relief package, it's not going to be for the corporations. It's going to be targeted at the workers. And the airline relief package says, point blank, it has to go to the pay, benefits, and salaries of the workers. Well, the GOP didn't like that, and so they tried to water it down. And in the Senate, so they cut the funding. And then when it went over to Secretary Mnuchin, he said, you know, we're going to tax that money too, and we're going to take some more out of it. So that by the time they were done with it, it wasn't enough to cover all the salaries. And so the corporations, what did they do? They told people, you know what? Congress has extended unemployment benefits to people. So take a voluntary furlough. Go out, go get paid by unemployment. And we'll keep this money here at the airline and figure out how to spend it. And so now what we're doing is we're having flight attendants call us and say, I can't eat because I've tried to apply for unemployment insurance in Florida and I can't get it. I can't get the help that I need. This is really simple. This is really simple. We have to save lives and we have to save jobs, and we have to make sure that everyone has access to health care. This is not complicated. And so this is what we are calling for. And this is what we're facing on the job, is that as they're saying open up again, they're talking about sending us up into the skies where you cannot socially distance. There is no way in our job that you can socially distance. And they're fine with opening up the economy without the tools to keep us safe and keep the people around us safe.
Sarah, you know, you just said something. It is criminal. I'm just thinking about it. It's criminal, first of all, for you to take all the money at the beginning, give it to the corporations, and then argue now you don't have the money to pay people to ensure health care. It's criminal to break the system and then say, now you go back into the system. It's criminal to say, we know what to do to make it safe, but we're not going to make it safe. We're just going to send you back in anyway. I mean, that is a level of criminality that we have to challenge, and we have to and indeed, you know, speak out and organize against. It is because it's lethal. This is not just a battle. It is a lethal battle. It is a death sentence. And I want to insert here before we get to Kenya Polly, who is a nurse's assistant. We were on a call the other day, and she basically said, I'm probably carrying, one lady said, I'm probably carrying disease already, because she's being forced to a nursing home. She had to go get a garbage bag to put on. She doesn't have PPE. She says, you know, and I may die, but will somebody stand up and say that this is mass murder based rooted in policy? It's not natural. That's what we have to get. This is not natural. The disease is one thing, the pandemic is one thing, but our response and this willingness to thrust people back and say, as you said, the false choice, the economy or your life. No, we can have both. We can have both. Germany paid them people through a private public relations funding process. They only have 2% unemployment, and people got to stay off a long time. I think 4 or 5 months, if I'm not mistaken. Because we could do the same thing here. So thank you, Sarah. Thank you for for saying flight attendants and others are standing. And people need to know that, because we're trying to help other people see what the real face and voice of poverty and low wealth can actually look like. Is Kenya on?
Before we go on to Kenya, there was one comment from the chat for Sarah. So Sarah, Susan Robinson asked us, is there any data about how many flight attendants have been impacted by COVID-19 and coronavirus? People are asking, like, how has this specifically impacted the community?
Yeah, so we know for sure that there's 8 flight attendants who have died. We don't know the total numbers. This is low reporting that 500 have tested positive. I think it's very low reporting, because actually we had a very difficult time getting tested at the beginning, and there's no contact tracing. There has been no notification to flight attendants when they have come in contact with the coronavirus. So in some cases, they were notified 10 days after the event. And then they've already flown several other flights and potentially infected other people. So we have had a very difficult time tracking that down. And that has been a major problem, is actually just getting our hands around what is the real problem and where can we find it so that we can address it and eradicate it.
And Reggie, remember, we're dealing with a government that doesn't want to do data.
Yeah, right.
They're pulling the old Ronald Reagan trip. You remember when Ronald Reagan cut all of the funding for the civil rights data reporting and then claimed that racism was over?
Right.
That was an old trick, so that they don't want to keep data on like the number of people within various jobs. They don't want to keep the data on poverty. They don't want to keep the data on race. They don't want to keep the data on zip codes, which is actually what we should be doing now, because then that would help you target a lot of the things and where you need them. So that's another thing. Again, remember what Jeremiah said, they lie and they don't even blush about it. That's why we have to be truth tellers, and we got to organize this 100,000 calls next week and tell people to stay home, stay in place, stay alive, organize, and don't believe the lies. Kenya?
Well, we have to, because of spatial constraints, Reverend, we have to tell Sarah goodbye to bring Kenya on.
No, don't say bye to Sarah.
Yeah, and she also has a time limit that we want to be mindful of. So Sarah, thank you for your tireless efforts on behalf of working people before the pandemic, and especially so now. Like, your focus on economic justice as we seek to balance these things out is inspirational. And like you said, we can't go back to normal, and you know that MoveOn and the Poor People's Campaign support you as you stand up for working people. So thank you for that.
Thank you. Forward ever, all of us together.
Always.
That's right.
Thank you, Sarah. And Kenya's almost here. So
Yes. Hello, everybody. My name is Kenya Alcocer. I am with Unión de Vecinos here in Los Angeles, the LA Tenants Union, and one of the co-chairs of the California Poor People's Campaign. I'm also a member of the Popular Education Project, wearing many hats here. The reason why our community and our entire body here in the state of California is supporting the Stay in Place, Stay Alive initiative and campaign is because normal before wasn't good. Normal before meant 10 million people living in the streets, being homeless. It meant 18 million houses empty across the country. Normal before meant that if you lost your job for whatever reason, if you got sick, that you would end up in precarious conditions of being either homeless or in transitional homes. And that is why before this pandemic even started, we were organizing to get rent control at the state level. We were organizing to get eviction moratoriums. We were organizing to get anti-harassment laws for tenants. So for us, this going back to normality means going back to people still dying, going back to people still being homeless, going back to people not having access to healthcare. COVID-19 has actually given safe haven for a lot of people that are poor. It has allowed for homeless communities to be housed. It has allowed for states to take action and give access to healthcare to people that usually never have access to healthcare. It has allowed for workers to actually push back and organize as workers in their workplaces to demand the things that need to happen. And for us here in the state of California, in April 1st, we decided to go on rent strike. We decided to go on rent strike because a lot of our members said they didn't have the money to pay their rent for April 1st. Now, this is not the typical rent strike where people are holding their money back and are saying to the landlord, we're going to fight back against you. We're building community power. This is a different type of rent strike. This is rent strikes of people that cannot pay their rent, but we're turning this rent strike into community power. The way that we're doing that is by telling people, even if you are still working, like myself, even if you still have a job and are you're getting your paycheck, don't pay your rent. Why? Because you don't know that every time you step your foot at that door, if you're going to get sick or not. You don't know if you're going to bring that disease back to your family. Keep that money to feed yourself. Keep that money to buy your medications. Keep that money to stay alive. Choose life over death. And that is a basic principle within this Food Not Rent campaign. We are telling people, don't give your money to your corporate landlords. When we're talking about rent forgiveness and rent cancellation, we're giving a very clear message to the state. We don't want that the money or the little money that you're giving us to go to the pockets of corporate landlords or to the banks. We want that money for survival. A lot of us have children that we are now having to teach at home, that we need to buy supplies for in order for them to keep up with their studies. Some of us have children like myself that have medical needs. He needs oxygen tanks, he needs medication. These are the things that I'm putting a priority to. I'm not paying my rent, even though I'm currently working. The little money that I do have, I'm saving it for food, I'm saving it for healthcare, and I'm saving it to make sure that after this crisis, I can get back on my feet and my family can get back on its feet. My husband lost his job during this crisis. So there's only one salary in this house. And that is the fact, and that is the reality for many people. A lot of people didn't lose their jobs. They were forced to stay at home because their children are now at home. So this is also a reality that it's happening. And that's what we're saying. No, let's stay at home. Let's show this country that we're not just essential as workers. We're not just essential. If our work is essential, then you better provide the essential needs that we need. We need housing, we need healthcare, and we need better working conditions and better pay.
Yeah. And Reggie, before Kenya, thank you for that. I just wanted to make two comments before I turn everything over to Liz. And you know, I just sat here and got mad again, Liz, that they calling people essential workers. Why is the word human being not enough?
Mm-hmm.
You know, like you're an essential worker. Well, what are other workers? What, you know, healthcare shouldn't be tied to your job. It should be tied to your humanity. A living wage should be tied to your humanity. I deliberately have my picture up. I mean, we got to watch these little tricky terms, even when they sound, you know, we are his human beings, made in the image of God. And the worker is deserving of their hire. And everybody has, what they say, Liz, a right. Everybody has a right to live. In the story. We don't need any more slogans from the corporate folk or cute politicians that don't have any power in them. They're just terms used to continue the oppression by giving out cute words. And then lastly, I sat here and just thought about, we also don't want to talk, we should never use the language new normal. We don't want no normal nor new number. We want revolution. We want a radical revolution of vibe. We want a moral revival. We want a transformation. Nothing normal anymore. You know, nothing normal anymore. You cannot have normal when something is sick. And then, Kenya, I am so glad. Liz had told me about y'all, but I am so glad you just decided to do what the corporations did. They said they were going to save their money too. Yeah. I mean, that's what they said. They said, give us, they said, in our money. You give us other folks money. You give us $2.5 trillion. And what we're going to do is we're going to save our money and then take the money you give us and make another $400 billion over these past 2 months. That's what they said. So Kenya, if they ask people like anybody like we see, I'm just modeling what the corporations do. I'm modeling what the greedy do. They said they weren't going to spend their money either. They don't want to sacrifice. They don't want to give back the tax cuts They want to continue to take and take and take. We're not taking, we're simply taking a stand.
That's right.
And thank you for that. Liz?
Yeah, so I just wanted to ask Kenya one question before you might have to go, but I was hoping you could tell us a couple of the stories that you're hearing. I know that you've been calling around, people have been in touch with you, not able to pay their rent, low-wage workers that are trying to figure out how to organize the homeless. And so can you just share a couple of the calls you've had, the Zooms you've had in the last, week or two, just of real people dealing with this crisis?
Great question.
So before this crisis, we had a lot of tenants that were pushing back against landlords because of bad conditions in the homes. Now that people are actually having to live in those homes, the tensions have become even bigger. We just currently had on Mother's Day an apartment caught on fire. An entire family is now being displaced. Landlord is refusing to give them relocation. And these are the stories that we are hearing every day. We're having landlords that are locking tenants out, literally evicting them, even though the law currently says that there's an eviction moratorium in the state. So locking people out, we're having to go out on the streets and really protest and organize and push back against police departments that are refusing to protect tenants at this moment. There is an order to stay inside your dwelling, whether that is a tent or an actual apartment or a garage. And these are the fights that we're having to do across the state. I am proud to say that here in California, we have the California Homeless Union, who is actually fighting back against sweeps. We have a lot of our regions in Sacramento, in Marysville, in Chico and Paradise that are pushing back against a lot of these sweeps, and now putting lawsuits against departments and cities and counties for doing such things. So here in the state of California, we are pushing back, but this is something that it's very important, and I think that gives us the ability to really push back against everything that is happening. Being part of the Poor People's Campaign is so important because it unites us, not just in small areas and localities, but nationally, internationally. And this is something that we need to realize. We had a protest 2 weeks ago in front of a hospital that is owned by the same owner that is shutting down a hospital in Philadelphia. This is important because if someone is suffering, even if it's in another state, that means that people are suffering here too. While we were protesting, we had a elderly lady come out saying, I needed my treatment. I had to pay $2,000 and now I don't have money for my rent. And that is the stories that we're hearing every day. People are having to choose between medication, paying their rent, to choose between food, paying their rent. We have people that are rationing their insulin just because they don't know if they're gonna have enough money to purchase more. We have insurance companies that rather they like to get your money but don't want to spend money in your healthcare. Those are the things that need to change. The one thing that I want to say too is that when we've been talking about fusion for the last 2 years, it's been hard to get that fusion going, especially when people are still thinking about their own movement, their own issue.
That's right.
This has completely shifted things. Undocumented people like myself are now having to talk about other issues than just undocumented issues. Housing is an undocumented issue. Healthcare is an undocumented issue. Even voting rights is an undocumented issue at this point, because some of our children aren't getting the benefits that the government's giving currently. My daughter is a U.S. citizen. She ain't getting no relief. So these are the things that we need to talk about. And I think that people are coming together, people are organizing, people are mobilizing, and the Poor People's Campaign has given us the tools from the last 2 years to really build the power that it's needed to make sure that we do a tremendous shift and revolution in this country. So thank you.
Thank you so much.
I was powerful. I'm just saying she's powerful. I couldn't help it, Liz. I'm sorry. She just got me over here, just revolution. I mean, I'm serious. And I know you organized for June 2020, and we're going to hear these voices and help us make this 100,000 calls. But I'm sorry. I'm from a tradition where you hear something like that, you just got to say amen. Even though the program says no amen, you just got to say amen.
Amen.
Hallelujah.
Amen.
Go ahead, Liz.
Hallelujah. No, I so appreciate, everything that you just shared with us, Kenya. It's making me think about and get angry about the fact that, the billionaires have been making upwards of $500 billion in this crisis. But it came out yesterday that 40% of people that were making $40,000 or less have lost their jobs. The rise in poverty and suffering. And so what we want to do now is introduce Dr. Mary Bassett at Harvard University, who is a public health official who has been advising the Poor People's Campaign, a national call for moral revival, and can speak to this part about don't believe the lies. Can really help us inform the kind of work that we have to do, and that this country needs to be in place to be able to reopen safely and address this pandemic. So thank you so much, Dr. Mary Travis Bassett, for being with us this evening.
Thanks very much, Liz. And as Liz has said, I'm a public health physician and I'm the faculty of the Harvard School of Public Health. But I'm here this evening because I'm also a member of the Health Justice Advisory Committee that's working with the Poor People's Campaign. And there's a statement on the Poor People's Campaign website about reopening. So I would like to encourage all who are watching to look at that. I won't take the time to go through all the details that are in it. I am a public health person, so I deal a lot with numbers, but I think that the speakers that you've heard so far this evening have done something much more important, which is to tell you the human stories that lie behind all those numbers. But the numbers are pretty staggering. There are now nearly 4.5 million people around the world who have contracted COVID-19, and the number of deaths globally is approaching 300,000. In the United States, there have been close to 85,000 deaths. The fault in our response is buried in the fabric of our society, but also a great deal of blame lies with the absolutely fragmented and chaotic and reckless response, lack of coordination at federal level. But right now we're facing a new phase, as everyone knows. On April 30th, the federal government allowed the guidance on stay at home to lapse. And now the majority of states have decided to begin reopening their economies.
We're back. We had some technical difficulties, but that's what happens when you spit fire, right? So without further ado, let's welcome back Dr. Bassett, and so you continue talking about what you're seeing in the data.
Thanks very much. So I was in the process of talking about what the criteria are supposed to be to consider reopening the economy, and how public health criteria have been abandoned, essentially, because the driver of this is the desire to get the economy going, and in particular to save industries and bolster Wall Street. So you're first supposed to have cases going down. In other words, you don't have an epidemic that's continuing to grow. You have an epidemic that looks like it's coming under control, not just plateauing, but going down. But many of the states that have decided to reopen have new diagnoses continuing to go up every day. This is happening in Massachusetts, where I live. There are new cases going up every day. And then you should bring the measures up and not turn around and tell everybody that we're going to send you back to work. The next thing you're supposed to have in place is the ability to identify new cases, and that means doing testing. And as everybody knows, and we heard from Sarah, the flight attendant earlier, testing hasn't been very available. It's been bungled from the outset. And although the president declared that the US was doing a phenomenal amount of testing, in fact, over 20 nations do more testing than the United States. Germany, Spain, other countries are doing more testing than the United States. So there's not enough testing. And when you don't have enough testing, you won't be able to find the virus. because people can't get tested and people can be infected and not have any symptoms. And the next thing you're supposed to have in place is the ability to identify people who are infected, find them, help them to isolate, or and that may be complicated because many people live in settings where even if they're not very sick, they can't really isolate themselves in a crowded apartment, and they need to have resources, meaning that people should have another place to stay if they don't have the ability to isolate themselves at home. That doesn't exist at all. A handful of states and other jurisdictions are launching contact tracing programs. And so then you have to have the capacity to identify when things start going in the wrong direction, so that you can make new decisions. So that's why it's called reckless, because even by the standards that were laid out by the White House, which has really been a lesson in chaos and fragmentation, but even their own recommendations haven't been followed. The reason that people are being sent back to work is because they're being sent back to make money. But as others have said, this equation where we have to decide that we can't afford to save lives because we have to have people working in industries to make money for other people, that's a false equation. This is a very wealthy country. This country can afford to give people the protections that they need. That should be the goal, to bring the transmission of this virus down, doing whatever it takes to support people and not make them make these horrible choices of having to go to work to feed their families or face infection. There's a reason that people are complaining that they're being used as guinea pigs, because there's no reason to think that the reopening economies are safe to do so. So, that's why I'm talking to you. So you know the reasons that that it's not safe. The cases are still going up. The testing capacity isn't there. The ability to do contact tracing, to find people who are infected, find the people that they've been around, test them, isn't there. And the ability to respond and identify things going in the wrong direction isn't there. Even the ability to look after a new surge, if our hospitals have to start looking after these vast numbers of patients. Nobody wants to see the kind of chaotic situation with people in corridors, being very sick patients, on ventilators in emergency departments. So you have to have the capacity to handle a rise in COVID cases. The World Health Organization, which the United States has withdrawn funding from, has been probably the most consistent source of information about what's going on. And their lead in epidemic preparedness said the other day that we'll be living with this virus for a long time. So we have to learn how to help people live while we live with this virus. The idea that you lose your health insurance when because you don't have a job, if there was ever a time to see that this connection between employment and having health insurance is ill-considered, now's the time. We already were really in a unique position as one of the wealthy countries, and having literally millions of people, the estimates were 28 million people, had no health insurance. That includes people who are undocumented, who aren't eligible, but it also includes people who can't afford it. And despite the Affordable Care Act, we still had many millions of people. Now that number is growing because, as you know, we have over 30 million people who've lost their jobs. The estimate a couple weeks ago was that the number of people who lack health insurance was going to go up by 13.5 million. That number may have to be revised. And if it's revised, it'll be revised upwards. So there are millions and millions of people who, in the midst of a pandemic, are going to worry about whether they can get health care. And there was good reason to be worried about it even before, because, you know, this idea that you go to a hospital and you'll get free care for COVID, what kind of sense does that make? You can't sit at home and diagnose yourself with COVID. You go to the hospital because you're sick. You don't have COVID written on your forehead. Does that mean that if they find out you don't have COVID, now you're going to have to pay? How are people supposed to make these judgments and go? You know, what it means is that people won't go because they are worried until they have to go. And that's when we start losing people. And then anyway, I could keep going, but the people
did
who
you say
said
13 million? I'm sorry to interrupt, but I just want folks to hear. You mean on top of the
lost
28
their health
million?
insurance by June? Yes.
On
Additional
top of the 28 million?
28 million, yes. This is done by a group of researchers in New York City. They were previously on the Harvard faculty. And it's based on simple math. It's based on math. You lose your job. If you're lucky and you have a spouse who is insured and can cover you, then you may keep your insurance. So all that has been taken into account. And of course, it also includes dependents because
can we get
when
that
you
footnote to send it out?
Yeah,
Reggie?
I don't have it on me, but I will make sure you have that paper.
Okay, I'm sorry, Reggie. That number just hit me.
It's crazy,
yeah.
right?
Yeah.
So you know, but it's a carefully calculated number, and of course it just stands to reason, right? You people lose their jobs, they have their insurance through their job, they lose their insurance, their children and other dependents lose their insurance, and so the answer to that is single payer national health insurance. That's something that people have been fighting for a long time. But the reason that we need movements and the reason that someone like me wants to talk to people like you is because we have to come out of this experience with a better organization to our society. The reason that the wealthiest country in the world has the worst COVID outbreak of wealthy nations is because of societal failures. This wasn't natural. This was because we had these fissures along which this virus could track. Too much poverty, too much discrimination, too little health insurance, too few people who earn a living wage, too many people who have to work under conditions where they weren't protected. All of these things cost money to fix, but that's what you do when you're a humane society. You invest resources to protect lives. So I'll give you all the reference on the rising numbers of health insurance. It's an important figure to mention, and it may be even higher because people are continuing to lose their jobs. So I'm going to go now.
Dr. Bassett, just before you go, Liz, I was looking at this, why that shocked me so bad. And I can remember praying for the day we would have insurance just to cover pre-existing condition, because my daughter was born with a brain disorder. And I had one time my prayer was, I hope I live long enough to see her be able to get health care pre-existing. Then my state, has blocked Medicaid expansion.
Right.
And
I mean, we should all fight for single payer health insurance, but if you're in a state that hasn't accepted Medicaid expansion, there are 14 of them. Right. They should do that.
But what hit me was today, Liz, I was listening at a news person, and this was a Democrat, and they literally said, well, we need to do a few things with healthcare, but we don't need an overhaul of the system in the middle of a pandemic. And I'm like, that's exactly what you need. If you can't do it in the middle of a pandemic,
we need an overhaul. What is?
And I don't know that people understand what an outlier the United States is. Every other wealthy country is able to provide health care coverage to its population. Nobody thinks that you should have to, have a private fire department and only get somebody to come to your house for to put out a fire if you've like paid up your dues. There are certain things that we rely on government for. It's why we have governments. There are things that we have to do collectively that we can't reasonably do one person at a time. And having access to healthcare is one of those things.
Well, Dr. Bassett,
So
thank you for
I'll
your
get
time.
that too.
Thank you for your time.
Thanks. Thanks. It was very nice to meet you all and have a chance to chat a little bit and to find out about the Hairstones, you know. You're the first person I know I've met, Reverend Barber, who's known about Martinsville, Virginia. So I'm very impressed. So long.
Thank you, Dr. Bassett.
My pleasure.
So as we come to the end of the call, first of all, thank you for for your patience as we had some technical difficulties. But we'd like to announce right here that MoveOn will be participating in the Day of Action on the 21st of March by delivering over 2 million petition signatures supporting essential workers and contacting the Senate to demand that we pass the Essential Workers Bill of Rights. Any notion of staying safe and staying in place must include protections for these workers unable to work from home. So one way to support is to sign the Essential Workers Bill of Rights petition that we will deliver to the Senate next week on the 21st in the context of the Day of Action in solidarity with you all. So if you could text worker, WRKER, to 668-366 to add your name to the petition supporting Essential Worker Bill of Rights. Again, text worker, WRKER, to 668-366 to add your name to the digital petition drive that will be delivered next week. And in conclusion, from my end, yesterday was Stevie Wonder's 70th birthday. And in celebration, I listened to nearly 24 hours of DJ content on Instagram on Questlove's site while putting this program together and figuring out what we were going to talk about. And if it's possible to name a favorite song from the immense musical artistic genius of Stevie Wonder, one of my favorites is Love is in Need of Love Today from the album Songs in the Key of Life. And I mention that because in this moment, not only should we be reminded that we're in this together, and through dedication, perseverance, and collective action and God's grace, we'll be the ones who brought our country ever closer to its lofty ideals. But also, sometimes the most powerful act of love is saying no. Saying no to lies that are being perpetuated in service to economic relief at the expense of public health. We say no to the temptation of cynicism, thinking that things will never change. And we say no to systems of oppression and division meant to keep us down rather than include all of us. By saying no to all these things, we begin to say yes to the future that we all hope for and are committed to creating together. So it's now my honor to pass back to Reverend Dr. Liz Theo Harris and Reverend Dr. Barber.
Well, Reverend Liz is going to have the last word, and I'm just going to again say to folk, we need 100,000 people as a minimum to join us and to make 100,000 calls. And we're saying calls. We want to jam up the operators board to Pelosi and McConnell. Now, some of you may be Democrats, but we're nonpartisan. We have to push everybody in this moment because this country is locked in a neoliberal imagination. As long as it stays there, they always think first in terms of how is this going to benefit the wealthy and the upper part of the middle class, and then everybody else be okay. And it affects Democrats, it affects Republicans. It's more extreme with Republicans because to add it to theirs is a kind of social Darwinism that goes all the way back to Adam Smith and the extra parts of racism, and then of course the person they have in the White House and then McConnell. There is no excuse though that out of the House we should not get the bill that ought to be. If McConnell cuts it, if Donald Trump doesn't sign, that's not the point. The point is we have to have a bill that is what ought to be.
Yeah.
In this moment. And we're asking people to make these calls. We're going to have the ought to be on our site. Reggie, I also want to just, I don't say this even to those who are going in on the Bill of Rights. This is a love thing. I'm going to join you, and we're going to join in signing off on the Essential Workers Bill of Rights. But we also have to make sure that is not a Bill of Rights without a budget attached.
Mm-hmm.
Because politicians do some strange things. Remember when they passed the Green New Deal piece? And it was a resolution a set of principles.
It wasn't a program, right?
But it wasn't a program. It wasn't a budget. I learned a long time ago when I worked politics in the South. I worked in campaigns that fought against Jesse Helms and so forth and so on. In politics, you always have to ask a politician, what is the fiscal note? Because there's two things they'll use on you. They'll use task forces and they'll use resolutions. You hear what I'm saying? They use task forces. Just like, for instance, we have in our country a Bill of Rights, but you can't sue nobody over the Bill of Rights. If it's not in the Constitution, and if it doesn't have a fiscal note. So I want to encourage us as we support next week, those 2 million and hopefully another million. We also say we need this to be turned into, see, if it's in the Bill of Rights, it ought to be in the bill. Mm-hmm. It ought to be in the bill that comes out of the House at the very least. So you take the Bill of Rights, put it in the bill, not just as a set of rights with no fiscal note, but you make it a fiscal note and you put policy attached to it. Because I've talked to a lot of folk on the ground and they keep saying to me, and I know you heard it, Liz, we don't need any more titles like essential workers or hand claps or special stops at 6 o'clock to say how heroic we are. Heroes need, in the old days, in Greek mythology, whenever Hercules went out and did something, he got paid. He was a hero, but he got something. And we've got to make sure that we raise that and let folk know we never stop. We had an opportunity early on. Liz will tell you that we had our agenda, and a group of legislators came to us and said, we want to take the Poor People's Campaign agenda and we want to pass it as a resolution. And we said, you're not going to pass this as a resolution and then sit in the fire and then say, well, we passed the resolution. We want a bill and we want a fiscal note and we want policy because folk are dying. And so let us do what they used to say in the movement when they asked years ago. They would say, what do you want? And somebody would say, freedom. They say, when do you want it? Somebody say, now. Yeah. And then somebody would say, how much of it? They say, all of it. All of it. So we want it now, and we want all of it. Thank you to the MoveOn family. And Reggie, thank you. And Albert, I don't know how you did that, but you are, man, a bad dude in the Black vernacular. You a bad dude to pull off those 3 computers you had on. You look like you in the Bat Cave or something operating over there. So we are so thankful. Liz, love you so much. Go ahead and close us out and tell folk what we need to do.
All right. So I want to start with a quote from the Reverend Dr. Martin Luther King. He says that non-cooperation with evil is as much a moral obligation as is cooperation with good. To accept injustice passively is to say to the oppressor that his actions are morally right. Well, it is clear from our time together this evening, from hearing from essential workers over the past couple of days, from reading the petitions and the organizing campaigns of people all over the country, that the actions that our oppressors, those who are benefiting and profiting off of this pandemic, are anything but morally right, but in fact are unjust and need to be resisted. And so we are calling for a day of action on May 21st. Stay in place, stay in live, organize, and don't believe the lies. Call McConnell, call Pelosi, and organize in your communities. This is leading to June 20th, a mass poor people's assembly and moral march on Washington. We're going online and we're going big. The largest gathering of poor and low-income people, allies, people of conscience from across this country and around the world to hear the stories and the solutions coming out of this pandemic people coming together, raising our voices together and saying, we who believe in freedom cannot rest until it comes. So I want to thank everybody for being with us this evening. Please go to june2020.org for more information, both about the Day of Action on May 21st and to register everybody you know for the mass Poor People's Assembly and Moral March on Washington on June 20th. We have to build power. We have to come together with demands. And we have to say that nobody is free until all of us are free. And there are millions of people in this country, millions of people all over this world who are suffering needlessly. And what we need is a powerful movement that says that everybody's got a right to live. And everybody's got a right to live. And that we're going to fight and organize and strike and raise up our demands until everybody indeed has that right to live. And it is so. So thank you for being with us. Go to june2020.org to find out more information about the Poor People's Campaign, a national call for moral revival. Join us, join MoveOn, join everybody that is organizing, resisting, and non-cooperating across this country. And please stay alive and organize, because we can't believe these lies. Thank you for joining us.